Now let us start part 2 of fetal monitoring. So in part 2 let us continue with variable deceleration. So what is variable deceleration? According to the name you can see it should be variable. The fetal heart rate will be variable and it is seen mainly in the case of cord compression. So there is no fixed pattern between the fetal heart rate dip and the uterine contraction. Okay, so let me draw that. For example, this is the fetal heart rate. Okay, and here will be the uterine contractions. And you may see that here the uterine contractions and fetal heart rates are going in a completely different form, right? So there is no any relationship between this both, and the dip may be sudden dips are seen here, that is less than 30 seconds. So if you see before, in the case of this gradual dip in the early deceleration, gradual dip in the late deceleration, the dips are greater than 30 seconds, but here the dip is less than 30 seconds. Okay, so what is the management here? Management here is put mother in head low position, check for cord prolapse, give IV fluids, give amnio infusions, and if still persist, then persistent variable deceleration, then again it's an indication for C-section. So the variable deceleration and late deceleration are indications for C-section, whereas early deceleration is just wait and watch. Okay, so now coming to classification of this CTG scans tracing. Okay, so they are divided into mainly 3 categories. Okay, the first one is category 1, the second one is category 2, the third one is category 3. So what are these categories for? We are drawing now about CTG scan. Okay, so category 1 is normal. Everything, all the levels will be normal. Like if you see the fetal heart rate, it would be between 110 to 160, and beat to beat variability will be 5 to 25 beats per minute, right? And there is any no late deceleration, and there is no variable deceleration, and early deceleration either may be present or absent, and acceleration either may be present or absent, and this may be insignificant. Now coming to category 3. Category 3 is mainly seen in utero resuscitation with immediate delivery. Okay, category 3 is absent variability. There is absent variability of fetal heart rate with bradycardia. And there is persistent late deceleration. Okay, persistent late deceleration, and also persistent variable deceleration or sinusoidal heart rate pattern. All these are seen in category 3. Then what is category 2? It is in between category 1 and 2. Okay, that's it. So in between 1 and 2 will be category 2. 1 and 3. Okay, so finally let us discuss about biophysical score. So what is biophysical score? This biophysical score, also called as Manning score, it is done with the help of USG, and it is done over 30 minutes. Now coming to the 5 components of this biophysical score. The first one is fetal tone. So what is fetal tone? In 30 minutes, one episode of fetal extension, that is flexion, is seen. Fetal breathing movements will be greater than or equal to 1 breathing movement into 30 seconds, and gross body movements of fetus is greater than or equal to 3 body movements, and single largest vertical pocket of amniotic fluid will be greater than or equal to 2 centimeters, and NST is reactive. So total score is 8 or 10 by 10. Then the fetus is healthy. Okay, so based on this we'll give the score. For example, you can see here fetal breathing, what we have said from the beginning, we have said fetal tone in 30 minutes in one episode of fetal extension. If there is flexion, okay, you can give greater than 2, the score will be 2. For each of it you'll give 2 to score. Okay, the score should be greater than 2. Okay, so for each of it if you give 2, you can see a total 5 components are there, so 5 into 2 will be 10, right? And if the fetal breathing will be greater than 1, you will give score of 2. If the gross body movement is greater than 3, you can use score of 2. And if single largest vertical pocket of amniotic fluid is present, then you can use score of 2. If NST is reactive, you can use score of 2. So if you give all these scores 2, 5 2s are 10, so either 10 by 10 or 8 by 10, like any of the two may be missing, so then you can say it is a healthy patient. Okay, and if the score will be like about 6 by 10 or less than that, then it is, we need to do reassessment after 24 hours. And if the score is less than 6 by 10 on reassessment means again we will try to do it. If again also it is less than 6, then it is nothing but it is an indication of fetal hypoxia, so we need to terminate the pregnancy. So this is all about the fetal monitoring. This is part 2. So by this we completed fetal monitoring. Next we'll start with aneuploidy screen.